So we know about screen time and social media as a primary factor driving poor mental health. And so, yes, our public schools are on the verge of promoting more of this type of digital content and platforms to respond to the mental health crisis. So, are you comfortable with companies like Kooth data mining our minor children without your knowledge, talking to strangers without your knowledge? Are you comfortable letting them talk to random kids on the web on a regular basis and being pushed and accessed into content around psychiatric diagnoses or gender identity? Do you want your kids on another platform and this one pushed by the school?
So first of all, I find it very ironic that the number one issue we have is too much screen time and social media for our adolescents and young kids. And now the solution is to go back on the screen and, have more screen time with an app that, to me is going to be very dangerous. Sean, this is a tech company.
Yeah.
That's all it is, correct? And can you explain to us your thoughts on this?
I will, because I reacted to it just like I believe many parents will who read headlines or see something on the news. And on the surface, you may say, great, fantastic. The kids have been suffering over the last 2 or 3 years. We need some solutions. I'm happy to see that, my school district is taking some steps to improve the lives of our adolescents and our youth because it's a mess right now. But I think we've had enough conversations in this room and we've had enough guests that have really pointed out where these can go wrong. And I think as a parent or a teacher, you need to start having conversations about how the possibility of doing more harm than good. I have a list of things that I just kind of like quickly wrote down in terms of where the red flags go up for me. And even as, running a business, there's a lot of it as well. I want to get some things out of the way because I was kind of not alarmed, but I was really shocked. We know what's happening in terms of mental health as a business, but I looked at some venture capitalist information. There was a total of 35.2 million for mental health startups in 2011. 2020, it was 2.4 billion in funding. So let that just sit in for a little bit because this is one company that we're talking about, but there are going to be many others that are going to pop up. And they're all going to be marketing themselves under the very similar language of rolling it out under a public health crisis. There's a shortage of licensed clinical mental health therapists, and they're going to be marketing as they're providing a solution for those that are underdiagnosed or undertreated, and they're going to start using a lot of technology to kind of fill that gap to help people get diagnosed and help them get treatment. So in terms of this company, they are a public company. They had an IPO in August of 2020. They are traded on the London Stock Exchange. They have shareholders. Those shareholders want to see margins. You don't invest in companies unless you want to make money. So if you look at some of the business that exists out there for other mental apps, that means like roughly for every like $100 that are spent on the app, probably about 30% would go to a provider or a therapist. If that is a human being, which that generally means that they are low quality, low performers, low skilled, and they just want to get a job. And throwing more bodies at the problem is not the solution. It's actually the education of a quality clinician, going through the training, constantly being trained, getting the education, getting your license. All those things require many hours and experience before you evolve into a quality clinician.
I think one of the things is I think you can bypass that by not calling it mental health treatment.
But isn't it?
But when you talk about a mental well-being app that targets the mental health crisis, then that's exactly what they're doing. But I think it's going to extend beyond that. So when you are talking about the business of mental health,
yep,
this goes back to things that I've said before. Then they want you sick and dependent. That means they make more money when you are sick and dependent. So the more people, and now we're talking about kids here, the more people that they can identify as needing mental health support, the better it is for their business, right? And they're going to justify this through what's being identified as a mental health crisis. I don't know if anyone remembers Rahm Emanuel, who was the former mayor of Chicago. He was also, I think, chief of staff for Barack Obama. This is quote, "You never want a serious crisis to go to waste. And what I mean by that is an opportunity to do things that you think you could not do before." That's a famous quote from Rahm Emanuel, a politician. And that's what they're going to do, folks. They are going to be stepping further and further into the private lives of families and individuals. If you don't think that this has some purposeful means of being able to submerge, subdiverge, whatever that word is, and be able to indoctrinate your own children without your permission. Now, of course, there's ways. We don't know how the districts are going to implement this. I think they probably have some variability, but right now I think the Philadelphia School District does not require parent permission.
All the way down to the age of 11. So most districts are the age of 14. You don't have to have parent permission, but Philly's different.
Yeah, so let me explain that, and I don't understand that.
I don't either.
And I think we're going to need to confirm that. In the state of Pennsylvania, a 14-year-old can consent into mental health care without a parent permission. Okay?
What's typical outside the state of Pennsylvania? What other ages would it be?
I don't know.
Adult? My gut would say like an 18-year-old can do it without.
No, I have no idea, so I don't even want to speculate.
Okay.
So if Pennsylvania, if you can consent at 14, I can guarantee you other states have younger ages to consent. Now, the reason for that was for kids who were probably in abusive, neglectful environments,
okay,
or other type of environments, being able to access a hospital or mental health care without having to contact the parent who might be, for all we know, abusive. I'm going to assume that that's part of the intentionality around it, right? But now you can take advantage of these laws that you can have kids kind of sign up for these programs or these apps without having to get parental permission. And in our state, we've heard clinicians for decades misunderstanding and misrepresenting this law. This is about consent. It's not about privacy and confidentiality. If you're a clinician and you're working with a minor, it's very difficult to do effective work without integrating that within the family. And so it would be a rare situation where you're keeping stuff from a family. Obviously, there needs to be some degree of privacy in a therapy relationship to build up a trust with a teenager, but anything major should be certainly discussed within the context of a family. So just because a 14-year-old can consent without parent permission doesn't mean that these confidentiality laws protect them from having any communication with their parents regarding this. Now, we all know that parents should be monitoring the social media use of their children and have access to their phones and so forth. So that in itself can try to mitigate some of this. But, that's not going to happen. And they're going to target the most vulnerable.
I just wanted to break down the idea first of this is all text message communications. How incredibly difficult it is to understand context and emotion in a text message?
Yes.
Think about how many times that we in our own lives have misinterpreted the message of a text message. And when you talk about a mental health situation where maybe a teenager is appearing to be in a crisis, we know that even as when we were teenagers and for your children, they can be overly dramatic in a situation that is really not that significant.
Well, because we know that from brain development.
But
right?
We also know that based on the nonverbal cues and being around your children, you can see how they're acting. But the words that they're using, take those words and put them into text message form. How does somebody on the other side understand what's happening?
Well, they wouldn't. And teenagers, obviously, they are notoriously impulsive, and emotional. And that goes, we've had these discussions about brain development, right? We've lost a sense of what is normal in adolescent development. And so this is taking advantage of a vulnerable age group to monetize, to financially benefit from it. These apps like Kooth or the other ones that Sean says are probably in development and are being pushed, they are not here to benefit your mental health. It's a crock of shit. They are here to keep you attached to their platform.